Welcome back to Sustainable Health CNBC Indonesia with me, Mercy Wijaya. We now continue our discussion with Bapak Alfon, the COO and CPO of Halodoc. But we see that the current issue right now is about the medical inflation. This has been the major concern in Indonesia right now, with healthcare costs continuing to rise. From Halodoc perspective, how is medical inflation affecting patient behavior, corporate healthcare spending, and demand for telemedicine services?
Okay. So I think the research from global advisory brands from Willis Tower Watson says that Indonesia has predicted medical inflations is going to be around 15%, which is quite high, for example. And this trend has been increasing over the year as well, right? We see the industries, the insurance, for example, they're doing a lot of massive repricings in here and there because they need to sustain their business as well with the rising medical costs. So we see the patient's behavior also changing in this landscape because of this, right? Either they delay their care, which is, I think, really bad decisions, or they move to self-medications on certain diseases, right? Rather than like going to doctors, I know what medicines do I want to buy, or you normally use this for cough and flus, and then they do self-medications. Another trend that we see is like they come to our platforms because they want to save costs as well, right? Because we see is that when people consult online, you don't have to travel, you don't have to find a parking, for example, you don't have to wait in a hospital for a while. Can see a doctor only for basic needs, for example. So there's a growing trends that people shifted to online as well because of that, apart from the self-medication. Now, whereas on corporate, the pressure is becoming a lot more real, right? Because the increasing medical costs, it will directly impact their expenses of healthcare spending, right? Be it whether they use insurance, corporate insurance, or they use their own corporates to pay for their employee benefits, for example. Now, for them, what we see is like people now a lot more evaluating a couple of options apart from negotiating with the providers and so on, but also look at telemedicine online as the alternative way, again, to save costs. What we see is like, I think the costs can be saved between 50 to 70% depending on what your use case, right? Because you don't
50 to 70%.
Yeah, right? And then that's based on our data as well. We have this report that we recently published in Q2 that talks about that, where we evaluate 12 months data of people who is in the corporate programs and what's their behavior. One of the main measurements that we look at is when people do telemedicine, do they come back to see the doctor offline, right? If the people come back to see doctor offline, then we fail. But the study shows that at least around 90% on the cases that really matters or simple, we see that the reductions of hospitalizations or people seeing doctors close to 90%. So meaning that people doesn't have to come back to doctor again after they consult online. So those are the areas that we do a lot more research on to convince as well the corporate and clients to look this as an opportunity or alternative solutions rather than just like repricing the insurance, negotiates with the payer with the challenges of rising medical costs.
You say that this save a lot of costs compared to the traditional going to the doctor and so on. So how do you see the usage of this telemedicine industry in Indonesia, especially in rural area? Do you see the improvement?
The majority of the penetrations, I think, still happens in metro areas because they are more educated, more aware. They understand. They don't only see Halodoc, they see other digital products, right? Be it for your food, be it for your shopping, be it for your e-commerce, for your travel. They are more exposed and more educated and more understand that you can do this of digital health as well via applications, for example. So in rural areas, the growth actually is stable, but it's not as fast in metro areas where they have a lot more exposures towards this basically.
So you see a lot of growth in Indonesia. You still see a lot of growth in Indonesia.
Yeah, I think we still see double-digit growth, I think, in Indonesia, but still majority coming from metro areas rather than rural area because of those challenges that we see.
Talking about the performance in 2026, you see that right now, in a month, there are 20 million of active users, right? How is it compared to the performance last year?
I think what we see is the growth of people that stays in Halodoc. If you look at the growth overall, I think it's pretty stable compared to last year's, what we see is like the diversity of the access of transactions they do inside applications. So we see a lot more frequent transactions instead of like regular transactions. The type of users that stays and loyal to Halodoc, for example, because we solve their problems, is actually growing and growing as well. So one of our things that we measure is like how many people actually transact inside Halodoc in 1 year, for example, right? We used to see that, okay, on average, people transact in Halodoc based on the data is like 3 times a year. We used to see that as like, oh, then people actually sick 3 times a year, at least on average, for example. But when we dig deeper, as we grow 2025, 2026, the increase of the number of transactions has been gradually increased from 3 to 3.5, 3.6. But it's not just because that you are sick and then you consult Halodoc, but there is this growing trend of like preventive healthcare, right? You see the trends of healthy eatings, longevities, people going to the gym a lot more often, and they care a lot more about their health. I think that's also defined that we as a platform should also change, not only talking about we are here when you are sick, but we are here to help with your health. I think has been the transformations that we're trying to do, I think, over the past 2-3 years with our investment with digital clinic as well, right? We have a new products called HaloFit, which is specifically about weight loss, for example. That has been like a growing category as well, where people now wanting to take care about their weight. And obesity has been growing problems.
HaloFit, so that was the strongest growth right now, the strongest interest from the users?
One of the strongest interests, I think, is about that.
Okay. Talking about the contributions of the overall revenue, which segments is contributing the fastest growth?
I think it's still Indonesia's being like a self-medicating countries, I would say. The growth still comes to pharmacy delivery, basically.
Pharmacy delivery.
I think that's still dominating because the values of medicines and then like how people consume medications in Indonesia and their behavior of self-medication has helped tarnish that, help fuel that growth.
What is your Halodoc strategy in 2026? Because we see a lot of improvement in our technologies, the use of AI and the machine learning, also the big data analytics. Do you see any use of that in the near future, or already using it?
We're already using it actually.
Okay.
It's for us. It's the AI help us push the next set of innovations. When we started like 10 years ago, we talk about application, right? Nowadays, in our 10th anniversary, which we celebrate, I think, in April, we need to transform ourselves from what's our innovations towards applications now to AI, right? So a lot of the releases that we did in the couple of months and couple of years ago has been talking about like how we integrating AI in our operating system. So one examples that we did is like we now have AI companions when you open Halodoc applications, which is what we call Hilda, for example. So Hilda is when we introduce inside Halodoc application, it should help patient navigate a series of questions like when they comes to Halodoc platforms. Sometimes they don't know like, okay, which doctors do I need to go?
Okay.
Or they don't know that can I take these medications with my food, for example? Do I have to take the other one? Is there contraindications between these two medications that I ask? So we see a lot of people now coming to Halodoc to ask those type of questions. So we created those products to help those type of users, which at the end, then if they require to speak with an expert, then they still need to go to doctors. So the AI that we try to create does not replace the doctors, but to empower patients' decisions, also empower doctors to deliver a better consultation experience.